When most people think about cancer, they rarely think about teenagers and young adults. Cancer seems like something that affects older people, adults in their 50s, 60s, or beyond. But here's a sobering truth that every parent, coach, teacher, and young person needs to understand. Bone cancer specifically targets the young. In fact, the peak age for the most common types of bone cancer falls right in the middle of adolescence and young adulthood, between the ages of 10 and 20. This isn't a coincidence. It's directly related to how bones grow during these crucial developmental years. But here's the real problem. Because bone cancer symptoms in teens and young adults look so much like normal growing pains, sports injuries, or simple muscle strains, the disease often goes undiagnosed for weeks or even months. That delay can have serious consequences. Before we start with all the things that can literally save your life, please watch this video until the end. It's very important to have the full picture, and don't forget to subscribe our channel. So let's talk about the 5 critical warning signs of bone cancer in young adults and teens. This information is presented in a comprehensive but straightforward way, focusing on what young people and their families absolutely need to know to recognize these symptoms early. Understanding these warning signs could make the difference between catching bone cancer in its early, most treatable stages and discovering it after it has progressed. Understanding bone cancer in the young first, it's essential to understand what bone cancer actually is and why it particularly affects teenagers and young adults. There are 2 main types of bone cancer that occur in this age group: osteosarcoma and Ewing sarcoma. Together, these 2 cancers account for the vast majority of bone malignancies in people under 30 years old. Osteosarcoma is the most common type of bone cancer overall. It develops in the cells that create new bone tissue, called osteoblasts. These are the cells that are working overtime during adolescence, building and strengthening bones as young people grow. That's exactly why osteosarcoma peaks during the teenage years. It strikes when bones are growing most rapidly. The cancer typically develops in the long bones, especially around the knee, in the lower part of the thigh bone, the upper part of the shin bone, or in the upper arm bone. Essentially, it targets the growth plates, those areas at the ends of long bones where new bone tissue forms. Ewing sarcoma is the second most common bone cancer in children and adolescents. It's slightly different from osteosarcoma. Ewing sarcoma can develop not just in bone, but also in the soft tissue around bones. It most commonly affects the pelvis, the ribs, the thigh bone, and the bones of the upper arm. Ewing sarcoma also tends to occur during puberty and the teenage years, with most cases diagnosed between ages 10 and 20. It's more common in males than females, and interestingly, is much more common in people of European descent compared to people of African or Asian descent. Both of these cancers are rare in absolute numbers. Osteosarcoma affects about 400 children, teens, and young adults in the United States each year, while Ewing sarcoma affects between 300 and 400. But for the individuals and families affected, these statistics provide little comfort. And because these cancers are so rare, many healthcare providers don't immediately think of them when a teenager comes in complaining of bone pain. The key to improving outcomes is recognizing the specific patterns of symptoms that distinguish bone cancer from common injuries and growing pains. Warning sign. Number 1, persistent bone pain that doesn't resolve. The first and most common warning sign of bone cancer is bone pain that persists and doesn't resolve the way typical injuries do. Now teenagers and young adults are physically active, they play sports, they exercise, they roughhouse with friends. Bumps, bruises, and occasional aches are part of normal adolescent life. Parents and even doctors often attribute complaints of bone pain to sports injuries, muscle strains, or so-called growing pains. But bone cancer pain has distinctive characteristics that set it apart from these normal aches and pains. First, the pain is localized to a specific spot on a bone. It's not generalized achiness throughout the body or soreness in multiple joints. A young person with bone cancer will consistently point to the same specific location, maybe a spot on their thigh or their shin or their upper arm. The pain stays in that exact location, and it doesn't migrate around. Second, the pain progressively gets worse over time. This is critical. A sports injury might hurt a lot initially, then gradually improve over days or weeks as it heals. Growing pains might come and go. but bone cancer pain follows a steady upward trajectory. What starts as a mild occasional ache becomes more frequent. Then it becomes more intense. Eventually, it transforms into constant pain that's present all the time, regardless of what the person is doing. Third, and this is particularly important, in many cases of bone cancer, the pain is worse at night. About 20% of young people with osteosarcoma and a similar percentage of those with Ewing sarcoma report that their pain intensifies at night. The pain might wake them from sleep, or it might prevent them from falling asleep in the first place. This nighttime worsening of pain is a major red flag because typical sports injuries and growing pains generally improve with rest. Research on early symptoms of bone cancer has found that the pain is often intermittent at first. A young person might feel fine for days, then experience pain for a few hours or a day, then feel fine again. This intermittent pattern can be misleading. It makes the person and their parents think the problem isn't serious, but the key is watching the overall trend. If episodes of pain are becoming more frequent, more intense, or lasting longer, that's a warning sign that needs medical attention. Studies have also found that a significant number of teens with bone cancer relate their symptoms to some minor trauma. Maybe they bumped their leg or they got knocked during a basketball game. The person assumes their pain is from that minor injury. But the difference is this: the pain from bone cancer doesn't follow the expected healing pattern. A minor bump or strain should improve within a week or two. If pain from a minor injury is still present after 3 weeks, or if it's getting worse rather than better, that's abnormal and warrants investigation. Warning sign. Number 2, pain related to activity but not improving with rest. The second warning sign is pain that's triggered or worsened by activity but doesn't improve the way normal strain-related pain would. Young people with bone cancer often first notice their pain during physical activities. If the tumor is in a leg bone, the pain might appear while running, jumping, or playing sports. If it's in an arm bone, activities like throwing a ball or lifting weights might trigger discomfort. This connection to activity leads many people to assume they've strained something or overdone their exercise. But here's the crucial difference. Rest doesn't provide the same relief it would for a normal muscle strain or overuse injury. When someone strains a muscle or stresses a joint through overuse, resting that body part typically brings significant relief within a few days. The person feels better when they're not using that limb. With bone cancer, rest might provide some temporary relief, but the pain returns quickly once the person resumes activity. And over time, even rest stops helping. The pain becomes constant, present whether the person is active or completely at rest. This progression from activity-related pain to constant pain happens because the tumor is growing inside the bone, creating pressure and destroying healthy bone tissue regardless of whether that bone is being used. Research has documented that pain related to strain is one of the most commonly reported initial symptoms in both osteosarcoma and Ewing sarcoma. In one significant study, 85% of young people with osteosarcoma and 64% of those with Ewing sarcoma initially reported pain that seemed related to physical activity. This makes the cancer easy to miss initially because the symptoms seem so normal for an active teenager. What should prompt concern is when the pain doesn't follow the expected pattern of improvement. If a teenager complains of leg pain after basketball practice, most parents would reasonably suggest rest, ice, and maybe some over-the-counter pain medication. If that pain is significantly better or gone after a week of rest, it was probably a strain. But if the pain persists despite adequate rest, or if it comes back immediately when the teen returns to activity, that's abnormal. If this pattern continues for 3 weeks or more, it's time for medical evaluation. Another pattern to watch for is when the pain seems disproportionate to the level of activity. For example, if a young person feels severe pain after a light jog when they're normally able to run for miles without discomfort, that disconnect between activity level and pain response is significant. Warning sign number 3, swelling or a noticeable lump. The third warning sign is the development of swelling or a visible, palpable lump at the site of pain. Not all bone tumors create visible swelling, especially in the early stages. If a tumor is located deep within a bone or in an area like the pelvis or deep in the thigh, swelling might not be apparent for months. But when swelling does appear, it's a critical warning sign. The swelling from a bone tumor has specific characteristics. It's localized to the tumor site, not widespread or affecting multiple areas of the body. The swelling doesn't come and go the way swelling from an injury might. A twisted ankle swells up initially, then gradually decreases as it heals. Swelling from a bone tumor is persistent and progressive. It starts small and gradually increases in size over weeks or months. Research indicates that a palpable mass is noted in about 39% of osteosarcoma patients and 34% of Ewing sarcoma patients at their first medical visit. This is significant. More than one-third of young people with bone cancer have a lump or swelling that's noticeable enough to feel by the time they first see a doctor. This emphasizes the absolute importance of physical examination. A doctor must actually examine and palpate the painful area, not just hear about the symptoms. The lump might feel hard or it might feel somewhat soft, depending on whether the tumor is confined to the bone or has extended into surrounding soft tissues. The skin over the swelling might feel warm to the touch. In some cases, there might be visible dilated veins in the skin over the tumor area, caused by increased blood flow to the region. Here's what's particularly important about this symptom. If a young person has bone pain at a specific location and a lump or swelling develops at that exact same spot, this combination is highly significant. It's not normal for localized bone pain to be accompanied by a growing lump. This pairing of symptoms, persistent pain plus a growing mass, should trigger immediate medical investigation. Parents and young people should understand that they can and should examine painful areas themselves. If a teenager is complaining of persistent pain in their shin, for example, a parent should gently feel the area, comparing it to the other shin. Is there any fullness, any firmness, any abnormality that isn't present on the opposite side? Any asymmetry, one leg looking or feeling different from the other, is worth noting and reporting to a doctor. Sometimes, the swelling from a bone tumor can be mistaken for swelling from an injury, especially if there was some minor trauma that the person associates with the start of their symptoms. But swelling from an injury should gradually resolve over 1 to 2 weeks. Swelling that persists beyond 2 weeks, or that continues to increase in size, is not normal healing and requires evaluation. Warning sign number 4: fracture from minor trauma. The fourth critical warning sign is when a bone breaks from trauma that shouldn't normally cause a fracture. This is called a pathological fracture, and it's a significant red flag for bone cancer. As a tumor grows inside a bone, it destroys healthy bone tissue and replaces it with abnormal cancer cells. This process dramatically weakens the bone's structure. The bone becomes fragile, unable to withstand normal forces that healthy bone handles easily. When such a weakened bone breaks from minor trauma, or even spontaneously with no trauma at all, that's a pathological fracture. Studies show that between 5 and 13% of osteosarcoma cases present with a pathological fracture, and about 9% of Ewing sarcoma cases involve a fracture at some point during the diagnostic or treatment process. While these percentages might sound small, they represent a meaningful number of cases where a fracture is the event that finally leads to diagnosis. What constitutes minor trauma? Imagine a teenager breaks their leg while simply walking downstairs, or fractures their arm when they catch themselves during a minor stumble, or breaks a bone while doing an everyday activity like reaching for something on a high shelf. These scenarios, where the trauma is clearly inadequate to break a healthy bone, should immediately raise suspicion for an underlying bone problem. Often, a young person with a pathological fracture had been experiencing bone pain at that location for weeks or even months before the fracture occurred. The fracture might happen during a sports activity, leading everyone to assume the activity caused both the pain and the fracture. But the reality is that the bone was already severely weakened by the tumor, and the activity was simply the final stress that caused the compromised bone to break. Pathological fractures are particularly dangerous because they can delay diagnosis even further if they're not recognized as pathological. A doctor might treat the fracture without investigating why a minor impact caused such severe damage. The fracture might even begin to heal, temporarily reducing pain, which can mask the underlying tumor. This is why any fracture in a young person that occurs from seemingly inadequate trauma should prompt investigation for an underlying bone pathology. The types of trauma that absolutely should not cause fractures in healthy young bones include simple falls from standing height, minor bumps or collisions that don't involve high-speed impact, normal sports activities that the person has done countless times before without injury, and everyday weight-bearing activities like walking or climbing stairs. If any of these minimal traumas result in a fracture, the bone structure itself is suspect. After a pathological fracture occurs, X-rays of the broken bone will often reveal the tumor that weakened it. The tumor might appear as an area of abnormal bone texture, unusual bone growth patterns, or a distinct mass within or adjacent to the bone. This is why it's absolutely crucial that doctors carefully examine X-rays not just for the fracture itself, but for any underlying abnormalities in the bone. Warning sign number 5, systemic symptoms, fever, fatigue, and weight loss. The fifth warning sign is when bone pain is accompanied by systemic symptoms, particularly unexplained fever, profound fatigue, and unintentional weight loss. These symptoms indicate that the cancer is affecting the whole body, not just the localized tumor site. Fever is more commonly associated with Ewing sarcoma than with osteosarcoma. Studies indicate that fever is one of the distinguishing features that can help doctors differentiate between these two types of bone cancer. Young people with Ewing sarcoma often develop low-grade fevers that come and go. These fevers don't have an obvious cause like a cold or flu. The fever might spike in the evening or at night, then resolve by morning, only to return again the next day. This fever happens because the cancer cells and the body's immune response to them create inflammatory chemicals that affect the body's temperature regulation. Doctors have identified something called neoplastic fever, fever that's caused by cancer itself rather than by infection. In patients with bone sarcomas, neoplastic fever occurs in about 5.5% of cases. While this might sound like a small percentage, it's significant when it occurs, and it dramatically impacts the person's quality of life. The important thing to understand about fever and bone cancer is that it occurs alongside bone pain. A young person isn't just running a fever by itself, they have fever plus persistent localized bone pain. This combination is unusual and warrants immediate investigation. Fatigue in bone cancer is profound and unrelenting. This isn't the normal tiredness a teenager feels after a long day of school and activities, or the fatigue that improves after a good night's sleep. This is exhaustion that's present all the time, that doesn't improve with rest, and that makes even simple activities feel overwhelming. Young people with bone cancer often describe feeling completely drained of energy, unable to participate in activities they normally enjoy. This extreme fatigue happens for several reasons. The cancer cells are rapidly dividing, consuming enormous amounts of the body's energy and resources. The tumor creates inflammation throughout the body, which is itself exhausting. If the cancer has spread to bone marrow, it can interfere with the production of red blood cells, leading to anemia, which causes fatigue. The body is essentially fighting a war against the cancer, and that effort is exhausting. Weight loss in bone cancer is typically unintentional and unexplained. The young person isn't trying to lose weight through dieting or increased exercise. In fact, many young people with bone cancer lose weight even though they're eating normally. The cancer changes the body's metabolism, causing it to burn calories at an accelerated rate. Additionally, many people with advanced cancer experience loss of appetite. They simply don't feel hungry, or food doesn't taste right to them. Medical guidelines consider unexplained weight loss of more than 5% of total body weight over 6 to 12 months to be clinically significant. In a teenager who weighs 140 pounds, that's a loss of 7 pounds or more without any intentional effort to lose weight. This kind of weight loss, especially when accompanied by bone pain, fever, or fatigue, is a red flag for serious illness. It's worth noting that systemic symptoms like fever, fatigue, and weight loss typically appear later in the disease course than localized symptoms like bone pain and swelling. A young person who has all 5 warning signs, persistent pain, activity-related pain, swelling, and systemic symptoms, likely has more advanced disease than someone who only has pain. This is why catching the disease early, at the first signs of persistent bone pain, is so critical. The critical importance of advocating for thorough evaluation. So, what should young people and their families do if they're experiencing concerning symptoms? First, take persistent bone pain seriously. If a teenager or young adult has bone pain in a specific location that has persisted for more than 2 to 3 weeks, especially if the pain is worsening or not improving with rest, it's time to see a doctor. Second, be specific and detailed when describing symptoms to healthcare providers. Don't just say, "My leg hurts." Explain exactly where it hurts, how long the pain has been present, whether it's getting better or worse, what makes it better or worse, whether it affects sleep, and whether there are any other symptoms like swelling, fever, or fatigue. The more detailed the information, the better the doctor can assess the situation. Understanding the diagnostic process. When bone cancer is suspected, the diagnostic process involves several steps. It starts with a careful physical examination. The doctor will examine the painful area, looking for swelling, tenderness, warmth, or masses. They'll assess range of motion in nearby joints. They'll compare the affected area to the opposite side of the body to identify asymmetry. X-rays are usually the next step. These can show many bone tumors, appearing as areas of abnormal bone destruction or unusual bone growth. However, X-rays don't catch all bone cancers, especially in early stages, and they can't definitively diagnose cancer. They can only show that something abnormal is present. If X-rays reveal abnormalities, more advanced imaging follows. MRI scans are particularly valuable because they show not just bone but also soft tissues, allowing doctors to see the tumor's extent and whether it has spread into surrounding muscles, blood vessels, or nerves. CT scans are used to look for spread to the lungs, which is important because bone cancers often metastasize to the lungs if they spread.